So my name is Arthur Powell. I'm from Jamaica in the Caribbean, in the West Indies. I'm 58 years old. In fact, the 8th of May was my birthday. I celebrated my birthday here in India. So that was really wonderful for me to be here in this special continent that's holds so much history and so much love for myself, but also for people back in the Caribbean. Because our history goes way back when Indians were brought to the Caribbean as indentured servants, and many still resides here and make their home here. So India is very endearing to the friends all over the Caribbean islands. So I've been having a prostate issue for many years, and recently I decided to do a lot of tests, and so they realized that my prostate is very enlarged, and the way to deal with it was to get a TURP operation. So in my investigation, the TURP operation were costly in the Caribbean, and I checked other places like South America, the US. I have a doctor friend in Puerto Rico who's also told me that's about $7,000 to do here. So I'm thinking how to do this operation because my life was very uneasy. Have to be rushing to the bathroom, have to be careful how much water I drink. I can't drink the normal amount of water I need to drink per day because it's very distressing after I drink water. And especially if I'm in a very cold country or a cold environment, even a room where the AC's temperature is really low. So we decided to sort it out. I realized India the cost here is not that expensive. And so I contacted my friend, Dr. Farooq Motiwala, who operates the Homeopathic College here in India, in Nashik. And he said, yes, I can come and he can support me and help me to get it done. So I arrived here on May the 7th, and the very next day with him, he called up his friend, Dr. Shivde, who operates here at KIMS Hospital. And we do some examination. And then Dr. Shivde also called Dr. Mahajan, who's a urologist. And so they decided I need a sonograph, I need to do some more tests, hard tests, because I also brought my own tests that I've done back in the Caribbean. So they all realized that yes, this is a very large prostate, and for my age, I shouldn't have a prostate surgery. And so I came here in the hospital on Sunday. I was admitted, and by Monday, I was taken to the operation room. And being in the operation room, was talking to the nurses and everyone around me. I was given anesthesia, and then I didn't know anything else until a couple hours later. I saw all these people around with my name being called and smiling, said everything is done. And then I was moved to the ICU and then to the ward. But they're very wonderful hospital, very loving, caring, respectful people here, from the doctors right down to those who does the housekeeping. They're always there for you. They come around you ever so often, and especially that I'm an international patient and I don't speak the language. So everyone wants to know me, to speak to me. And one of the things, the food is very good. I must also say everyone is asking about the food. But I think the dietitian comes around every single day. They want to ensure that I have the proper meal that I need to have. Even if I'm not used to Indian food, they try to ensure that I have something that I'm used to. There's vegetable, there's salad, there's rice, there's dal, so there's many things that you want, and they ensure that you can have the basics of what you need. One thing I'm very impressed here is when I saw in the hospital from all levels, the investment in youth. I understand this hospital has been open about 5 months ago. And normally when a company, anyone opens a business, they tend to go for the more experienced people they can find. But this turnaround to really look at you to say, yes, we trust you, we want to go with you, they are the future, and to really put their money where their mouth is, to practice it, to live it, was something that is very endearing to me. And I see these young nurses, young doctors, people working around here as youth, who are so happy. They love their work so much. They're so energetic, so calming, so reassuring, so loving, so friendly, that I think, always go well for this hospital for the future. And for the individuals behind this who have really put this together. So this is my journey, this is my 6th day in the hospital. And they have been discharging me today. But I leave with a lot of joy. I didn't feel sick coming in, save for the prostate, and I don't feel sick leaving. And they ensure that. Right throughout the night, I've been attended to. So this is my journey. I just want to say many thanks to the doctors, the dietitians, the nurses, the mama and the Mauritians, or the housekeeping staffs who comes around to really ensure that I can live in good health, ensure that I'm well taken care of. And if I forget anyone, please forgive me. I've taken a few numbers that I'll keep in touch with them, just because they continue the friendship and the fellowship that has been developed. So thanks to all the staff and to everyone here. I'm really, really and truly and proudly appreciative. People back home in the Caribbean wondering, how am I doing? People here wonder, do I have a family here? But they all feel like my family. And that's all I can say. So I want to thank everyone for their service and for their love and dedication to what they're doing. Thank you.